I'm going to talk about HIV prevention and treatment needs of transgender women in public hospital in Cameroon. The outline will be in 5 key points. What I'm going to tell you first is that there's a lack of data for transgender women in Cameroon. But in 2016, we used a study for cisgender men who have sex with men to learn more about transgender women in Cameroon. And this assessment revealed that HIV is a great burden on transgender women, with 27% of prevalence, with great disparity, where you have, the pointer, from 9.6% in Ibertois and Bamenda to almost 53% in Yaoundé and Douala. Among these participants, 30% of the participants identify themselves as a woman or non-male. Also, compared to cisgender men who have sex with men, transgender women report more violence, more harassment, more stigma, and high inconsistent use of condoms. We also had a series of discussions with transgender women. And during these discussions, they report that one hospital in Yaoundé, during a HIV testing campaign, 20 out of 50 transgender women were tested positive. This is 40%. And this is close to what we found like in Yaoundé and Douala. There's also a structural barriers that limit access to healthcare for transgender, but also there's several programs that have been providing stigma-free health services, and this will be through hospital. And these hospitals are what we call a friendly hospital to transgender. Before moving forward with our talk, I would like to present Cameroon to you. It's a little country in Central Africa, squeezed by Nigeria, Chad, Central African Republic, Republic of Congo, Gabon, Guinea, Equatorial Guinea. And what we can say in Cameroon about transgender, when you take this big document, a strategic national document that guides fights against HIV, there's no mention about transgender population, or transgender specific health issue in this big important national document. And this is very, very important to know, because without this issue within this national document, it will be impossible to design any HIV or design any HIV implementation program. Also, within the program, the health professional training program, we don't have any education about gender identity, and specific health issue on transgender women, and also at large, key population. We don't have that key issue that drives epidemic in Africa within the training program for health professionals. And this is very difficult for them when these are young professionals that will be the pioneer to fight against HIV, but they don't have any knowledge about these key issues. As I was saying, there's a lack of published data on transgender in Cameroon. And the experience we have working with the government of Cameroon, when you don't have data on your hand, it's very difficult to move any key issue on the fight against HIV. I'm talking here about moving transgender woman health issue within the government. So we have also, as I said earlier, we have some hospitals that provide free stigma health delivery. But in majority, hospitals remain a stigmatized environment for transgender women. And that's the reality. I'm sorry. Okay. What are key challenges faced by transgender women? Stigma in receiving healthcare from healthcare professionals. And while they are in the waiting hall, they feel insulted and they are stigmatized. They receive scornful looks while waiting for health services. Also, in the counseling package, you don't have a transgender-specific counseling within the counseling package. There's also a conflictual relationship between transgender and other LGBT community organization, and specifically a cisgender men who have sex with men, because these organizations are where they go to seek sometimes health services. So usually our cisgender men who have sex with men just say that, oh, you are not part of us. You are different from us. So please stay away. So they found themselves on the street without nowhere to go. Without nowhere to go. Because probably they have been rejected by their family and other organizations don't want them to be there, so they're isolated. And this can lead to depression. So, program, as I was saying in the previous slide, program that support trans-specific health services don't last forever, because these programs are sometimes for 6 months, for 1 year, the most, and when the fund is not available, the program stops. So the service they were providing to trans are not longer available. So they come back to point zero without nowhere to go. So how do they feel? As I said, we had a series of discussion with them. They feel that even though there's a lot of stigma within the hospital setting, they feel that hospital is a setting where they can get services correctly done in a community organization. Why? Because of the confidentiality issue. Because as soon as they get in the organization, their HIV status will be out. Because they are not accepted fully within the organization. There's a lot of stigma in other LGBT organizations. And this second point is where it gets emotional when you talk with transgender women. They feel trapped in the body that do not belong to them. They say that this is not my body. I'm not this body you are seeing here. I want to change this body. But there's no way to go. Because the two only way we are offering is gender affirming surgery. I was looking a great video about surgery this morning, and I was very impressed. And I said to myself, we still have a long way to go in Cameroon. Long way to go. Also, a gender affirming hormonal therapy. It doesn't exist in Cameroon. And these people, they want to change their body to match the body they feel there is. There's not hormonal therapy available in Cameroon. And sometimes they use unsupervised hormonal therapy. And if I can recall, one say that, "Doctor, I'm using these PrEP sauvage in French. I know that this drug is killing me, but I have no choice. I have to use it because I need to change this body." You will see a photo in my probably next or two slides. And she said that, okay, my physical presentation is changing. I feel great about it, but I know that what I'm using will kill me sometime, but I have to do it. Just to tell you how they feel when they live in this kind of context. Hospitals provide non-specific, we will see in the next slide, non-specific health services which do not satisfy the real needs of transgender. As I said, there are no counseling targeting transgender women, right? There are limited training among clinicians to provide these services. If you don't know the issue, you cannot handle the issue well. And this is the problem we are facing. And if I can get off a little bit from there, sharing some experience, we met a lot of medical doctors, and they don't know anything about key populations. I'm not saying about transgender women, just key population, which is defined in Cameroon as men who have sex with men and female sex workers. Nothing about key population. And these people are the leaders who will run hospital, and they will supposed to receive these population, transgender women and key population, but they don't know anything about it. And this is very concerning. So, after this, I'm going to present the model we have right now, if I can call that a model. It's a NGO or community organization model, health service delivery model. So what we say here, these organizations are funded through outside funding. So they provide services free services for transgender women. And when you can see all these service package, it's very little about transgender women. This is kind of global general services that are provided to the entire population. So transgender women just get into the general population to get the same services. They do have specific services to get access to, but they don't. So these NGO and community organizations provide services to transgender through focal point that will facilitate access to health services and linkage to hospital for complex health issue. And this is hospital model. As I told you, very little. As I said during the discussion, only 15 hospitals in Douala and Yaoundé can provide stigma-free health services to transgender. And this is how they do that. Because when the program comes, they sign a contract with hospital, place a focal point within the hospital. And when transgender women comes to the hospital, she goes straight to the focal point. And the focal point will ease the navigation within the hospital to receive this package of services. And when you see the package of services, there's no specific transgender health services that are provided. So, as I said in previous slide, free services do not last after the life of the project. That's what I was saying, that when the project is finished, the service delivery stop and the transgender go back. So, after this consta with transgender, because this was within a series of discussion, we identify key strategic people, transgender women, to come with us and try to design acceptable model for them. I will not get into the detail. As you can see, this is CBL facility models. When you have a facility in the middle that provide these health services, and you can see the last point they were asking is hormonal therapy. Very important for them. And you have a CBO services. These are cisgender men who have sex with men that provide a package of services that you can see right there. And this is outreach activity. So, a personnel from a community-based organization will go into the community and give all these services. And most importantly, refer to health facility for complex health issue, or refer to CBO to receive a prevention services. This is a hospital model that we want to optimize. And this was built in strong collaboration with transgender women themselves. The second model is a CBO-based model. As you can say, CBO services, you have community-based organization, that SHAM program, that provides those services. So going to outreach provides also services, that's a package of services. And there's also NGO that can do those services, that provide those services. These are package of services that provide PrEP, PEP, community-based ART dispensation, and refer also to go to outreach and do outreach activity and bring those people in again. We use also online strategy to be able to refer those transgender women to hospital or to community organization. And you have the last model. This is what we call the integrated model, when you have all these actors intervening within transgender women, coming together. I know this is a very complex model. This is what we came up with, where you have all these partners working together in order to provide services to transgender. What we have to know and what we need to do. I think the first step in Cameroon is to know, to understand a local reality, reinforcing multi-sectoral mobilization around transgender population health issue. Very important. We also want to build on existing resources in Cameroon, including gender-based violence response and counseling, affirming hormonal therapy, and look forward for housing support. Because I was saying these people, these young transgender women, sometimes they are abandoned. They are abandoned by themselves on the street, no way to go. We need to seek housing support services. We also want to build capacity of existing community-based organization to provide a full trans-specific health services. Also, and this is very important, including population, key population issue in health professional training program. So, as I was saying, without the data, you cannot get any advocacy move forward. So that's why we need to conduct a research study for population size estimation, transgender specific health needs, hotspot mapping. Because sometimes when you meet government people, they say where they are, how many there are, and you cannot say anything. So that's why it's very important to conduct these research study to have these data. And also within the hospital environment, provide a stigma mitigation within this hostile environment. And if I can share my personal experience with you, just a few minutes, just to show you the state of mind of these young professionals that will lead the fight against HIV. When I first meet my boss, I think he's here in the room. He's also one of my mentors. He told me, you will go to Cameroon to work on key population. I say, what is this man talking about? Key population in Cameroon? There's no way. So, this is how these medical doctors think. They don't know. So they don't have any knowledge of key population issue within Cameroon. We are very hopeful things will move forward, and we are waiting for your support to move things forward in Cameroon. Thank you.